Hi, and welcome to EPICenter's Early Onset Psychosis 101 orientation for teens. My name is Megan Irgens, and I'm a mental health provider at the Early Psychosis Intervention Center, also known as EPICenter, at the Whole Health Clinic in Tucson, Arizona. In this video, we will talk about what early onset psychosis is and what to do if you or a loved one is experiencing symptoms of psychosis. Let's describe what early onset psychosis is. Psychosis is a brain disorder that makes it difficult to figure out what is real and what is not. To better understand psychosis, let's start with the brain. You know that powerful, weird-looking organ that we carry inside our skulls? Yep, that one. The brain is in charge of controlling and regulating everything that we do. It keeps us alive, keeps our organs like the heart, kidney, and lungs working. It controls our movement, our language, our memory, and it's responsible for processing our emotions and thoughts. It helps us understand ourselves, other people, and the world. The brain is where our imagination and our dreams live. Yep, the brain is amazing. The brain gets information from our senses. For example, you're outside in the park and visual stimuli come through your eyes. This information is sent to the visual cortex of the brain, where it sees the images around you. Trees, people walking, dogs, clouds, kids running. At the same time, auditory information, like sounds, like birds singing, dogs barking, and people's voices, come through your ears and travels to the part of the brain responsible for interpreting all these sounds. Smells come through your nose, and your skin picks up temperature and the sensation of the wind blowing. In a single millisecond, all of this information comes from the senses and goes to your brain. Your brain then puts all that information together and uses it to make sense of what is happening out in the world. Yes, it is a beautiful day at the park. Psychosis is a disruption of the brain process. In other words, psychosis occurs because the brain starts to make some mistakes. For instance, a teenager with psychosis may hear whispers or voices or other sounds that are not really there. This is called an auditory hallucination. A teenager may also see things in odd ways. For example, everyday objects may seem very bright or odd colors. Someone may see things that are not really there, like shadows or colorful creatures or even people. This is what we call a visual hallucination. There's another way how psychosis can present. Sometimes the brain misinterprets information and convinces someone that the wrong information is true. This is called a delusion. As a result, someone may believe things that are not true. For instance, a teenager with psychosis may believe that the FBI has hacked their phone or that every single person wearing a blue jacket is a spy. That is called a paranoid delusion. Another teenager may feel that he has a special power that nobody else has, like having the ability to save the world from evil spirits. This is called a grandiose delusion. Other symptoms of early psychosis are having difficulties organizing thoughts and language. A teenager with early psychosis may have a hard time understanding the meaning of everyday questions or explaining what she is thinking. So let's review. Psychosis is a brain disorder that makes it difficult to figure out what is real and what is not real. Psychotic symptoms include auditory or visual hallucinations, that is hearing or seeing things that are not real, delusions, which is believing things that are not true, and having a hard time organizing thoughts and language, making it difficult to understand the world around you. If the symptoms last and they are not because the teen was doing drugs or has a traumatic brain injury, it's called a psychotic episode. Now, why does psychosis happen? Good question. The truth is that there's not one single cause of psychosis, and the factors that lead to psychosis may change from person to person. However, researchers have found several reasons why a young person's brain may begin to experience psychotic symptoms. In some cases, psychosis or another serious mental illness may run in the family, which can cause a teenager to have a genetic predisposition to develop psychosis. Teenagers who are living with lots of stress can also experience psychosis. Their brains can get to a point of not being able to handle what is happening in their life and may develop psychosis as a result of chronic stress or even trauma. For example, losing a parent in a car accident or feeling too much pressure to get good grades, keeping a job and dealing with problems at home. Some teenagers experience psychosis because of drug use. Particularly, cannabis is known to disrupt a young person's brain who is developing psychosis. Other drugs like LSD, methamphetamine, and cocaine can also contribute to an episode. Some teenagers will not experience psychosis when they are using these drugs, but others will. And in some cases, psychosis continues to happen weeks and even months after drug use has stopped. Some young people experience only one kind of psychotic symptoms. Others experience more than one. Everybody's brain is different, and psychotic symptoms change from person to person. Keep in mind that often teenagers who are experiencing psychosis are also experiencing other mental health problems. Some maybe feel depressed, unmotivated, and may even think life is too hard and they don't want to be alive. Others may feel anxious and constantly worry that something bad is going to happen. Some teenagers may not eat healthy, some may have a hard time sleeping well, and others may struggle to stop using alcohol or drugs. Being a teenager is an exciting time. It's a time to try new activities, learn new things, and make new friends. But it's also a challenging time. Many teenagers with psychosis struggle to keep doing things they used to enjoy. For example, someone who may have enjoyed going to school before having psychotic symptoms, but now she may struggle to pay attention in school or finish her work. Another teen may feel unsure of how to relate to his peers when his brain is not working as expected. They may withdraw and spend too much time alone in their rooms. Their parents will likely worry, unsure of what is going on. Let's review. Psychosis can happen to anyone and can start unexpectedly. If you or someone you know is experiencing psychosis, remember, you are not the only one. There is not a single cause of psychosis, but we know that high stress, drug use, trauma, and family mental health history can contribute to developing psychosis. Most adolescents experiencing psychosis are struggling with other problems like depression and anxiety and feel confused about what is happening with their brains and what to do about it. Now, a very important question to ask: what to do if you or someone you care about is experiencing psychosis? First, say something. Most teenagers experiencing symptoms wait months, even years, before they tell someone. If you are noticing your brain is acting up, talk to someone you trust. Second, get help. It has been proven that teenagers and young adults experiencing psychosis can really benefit from specialized services. A comprehensive treatment includes 3 components. Number 1, medication. There are medications known to help the brain in reducing psychotic symptoms, like visual and auditory hallucinations. Some medications have side effects, like gaining weight or feeling tired, and some teenagers don't like to take them because of the side effects. However, finding a good medication match can be life-changing. The key is to have frequent conversation with a medical professional, such as a psychiatrist, to identify the most effective medication. Number 2, therapy. Cognitive behavioral therapy for psychosis is a type of talk therapy that helps teenagers and young adults who struggle with psychosis to better understand how their mind works and how to improve their thinking skills. Meeting with a therapist trained in CBT for psychosis techniques has proven to help teenagers with early onset psychosis and their families. Number 3, social interventions. The goal of social interventions is to help teenagers keep an active life, stay in school, and maintain healthy relationships. Examples of social interventions are social skill classes, job training, and peer-to-peer conversation. The combination of medicine, cognitive behavioral therapy for psychosis, and social interventions is the best way to treat early psychosis in youth. EPICenter is a specialized program at the University of Arizona, located at Banner's Whole Health Clinic in Tucson, Arizona. The EPICenter provides comprehensive services to adolescents and young adults with early onset psychosis and their families. If you or someone you love is experiencing psychotic symptoms, we are here for you in your community. Our services are comprehensive, bilingual, and covered by insurance. To contact us, you can call us or send us an email. Here's our contact information. Thank you for watching our Early Onset Psychosis 101 for teens. We hope you found this information helpful. Remember, we are here for you. Contact us and let us know how we can help. We wish you well wherever you are.